Okay, good afternoon, Commissioner. We're actually here for a special edition weekly video. It is Thursday, August 6th, and we wanted to get out a somewhat urgent message to our staff, given what has happened in Connecticut in regards to the hurricane.
Honestly, Ken, this is just one more thing on top of a tremendously rough couple of months. The tropical storm turned into a hurricane, turned into a tornado. I mean, I'm not a meteorologist, but whatever that weather event was earlier this week, it was pretty significant.
Yeah. And I think right now the latest reports indicate Connecticut still has over 600,000 homes that do not have power, and that leaves families without air conditioning, refrigerators that are working to supply food, and obviously lights and other forms of communication, and that includes obviously DCF staff, which raises concerns on many levels.
It does, Ken. I'm one of those households without power. So the first part of this conversation is really about checking in on our staff. We have people that live in various parts of the state. We even have folks that cross over state lines to come to work every day. We know that some of the travel restrictions and concerns that are out there have impacted our staff that are coming from Rhode Island. So we've had to, look into getting some additional clarification about traveling across state lines from a hotspot. We also know that we have staff that come in from Westchester County, New York. Not so many staff that come from out of state, but the staff that are in state too were just impacted mightily with this storm. Hats off, though, to our SolNet staff and our Careline staff, because they don't miss a beat. Our 24/7 operations really understand what it means to be there and to be present. And so all of them have really weathered the storm and are still kind of producing what they need to do over the last couple of days. So that has been a real positive in terms of our 24/7 operations. But I really want to make sure that our staff recognize that we're worried about you. Please check in on each other. Check in on your coworkers, check in on your unit mates, check in on your supervisors, and vice versa, because we just want to make sure that everybody is okay.
And that checking in also extends to our foster parents, whether or not they have a child placed into their home, to ensure that they have everything that they need. And certainly some of our foster parents take on medically complex children, so there may be some additional supports they would require. And it's really important we make that connection and allow them to know we're here, we're concerned about them, but also then to hear what it is that we could do a little bit differently right now to support them.
Many of our temporary group homes or community-based congregate settings have kids that are placed there, and we've been getting a lot of the risk management notices about damage to some of those properties, and some of them have lost power. Many have generators, but others are trying to make do like we are. So check in on your teenagers that might be placed in those settings as well. Oftentimes they need a little extra support and guidance when things are uncertain or unpredictable. That's another group that we probably should pay really close attention to. And of course, the kids and families that we serve that are in in-home cases. We've recognized that throughout the pandemic, there have been really stretched resources, particularly around food. And when you think about power outages and what that could mean to loss of food and not having, the ability to refrigerate things that, you're really trying to stretch as it is, this can just be a recipe for disaster. I also heard recently that there was a bit of a shortage as it relates to baby formula. Making sure that, kids from our babies all the way up through our teenagers are checked in on during this time is really, really important.
Now, if staff are at home and they don't have power and they're unable to complete their work, there is the option that they can go to their local office, as long as they practice social distancing and wear a mask. But it's really important that if those situations arise, they connect with their supervisor for approval to do that.
So our offices are still not open to the public. Engineering has been doing a wonderful job over the last few weeks of assessing, what the needs are for our physical locations. There is the opportunity if staff need to go to an office to work because there's Wi-Fi connections. I think there's only a couple of places where there are restrictions as to who can be in the building. If no one, I think there might be one or two that are closed, and I don't want to indicate which those are right now because it's changing by the hour. We just received Everbridge notification about that, and I just want to reiterate the fact that while we appreciate people wanting to come into the office to get their work done, you can't make that decision unilaterally. You need to be talking to your supervisor and the office directors of those physical locations because the DAS managers need to know, or the DAS maintenance folks need to know how many people are going to be in the building. Of course, have to make sure that capacity levels that we know before were never anything that we had to pay attention to. Now, because of capacity restrictions in certain locations, we need to make sure that everyone just, doesn't show up all at once. Some of the signage is still starting to just get put up, but we want to remind people related to wearing PPE and social distancing. If you're coming into an office for the first time in a few months, things will feel a little bit different as we try to navigate around each other.
Absolutely.
This is by no means requiring people to go to an office, but just letting folks know that it's available, but with the proper authorization and permissions.
Yep. And I think you had mentioned early on in the video that, here we are, another barrier, another roadblock, right? To not just getting our work done, but to existing and being a part of our community. So it goes without saying that we also have the employee assistance program that's available to all of us and our families if in fact there's a need for an employee to outreach for some support for themselves or a family member.
They have a tremendous amount of offerings that staff, just taking a few minutes to either log on there or give a phone call. This is a lot, Ken. This, what we've had to experience over the last few months and over the last couple of days has just been, something that none of us could have ever predicted. And, really trying to figure out how we navigate the day to day. Sometimes you need a little bit of extra support. And so, outside of checking in on each other, sometimes there's some additional help that can be secured, and EAP is for that. It's a confidential source that all of us can use to be able to just talk it out. This is something that we shouldn't try to handle all on our own.
Agreed. So as we indicated that today is Thursday, we're going to send this video out a little bit earlier than typical. So the following week, the following Sunday, we are going to have some solid updates on a number of topics staff have been asking about. Additional triage cohorts, more clearly defining what we mean by resuming operations and how we go about making the decision for our youth in our custody returning to school.
Yeah, all of those are fluid decisions that we're, really working with each other and our stakeholder partners, whether it's in the state Department of Ed or within our own educational division here within the department, really talking through with our foster care leaders and leads about, thinking through how to make those back to school decisions. We recognize that no one size fits all. And if anything, today we had our legislator call, and one of the best compliments that I think our staff need to hear is that one of the legislators on the call said that if any department was ready for the crisis that we've been thrust into, it's DCF, because we deal with crisis every day. And, that's the story that we've been wanting to tell over the last year and a half as we've kind of transversed the state and really heard from our staff and, talked about what we were trying to develop. It was really that opportunity to help people understand that our 3,200 staff members work really hard every day to make sure the mission critical work gets done. But, we do it in sometimes circumstances that are just unbelievable. So, what this week has shown us is that resilience continues even when the power doesn't, but also recognizing that sometimes we all need help and assistance. And so next week, we'll start to talk a little bit more about what back to school might look like for the kids and families that we work with. I got to tell you, I'm really concerned about the achievement gap in Connecticut. We already know that it's pretty wide. We're
Yep.
such a small state, and the differences between the haves and have-nots. We've been talking a lot about, equity and equality and all those things. This
Mm-hmm.
issue of return to school has some of those hallmarks. We talked about that last week in our video. We'll talk a
Yep.
little bit more about the back to school stuff in our next video. But this week we did it early so we could give people an opportunity to kind of hear from us and for us to check in on everyone's well-being.
You bet. So at this point in the video, you typically go over the most updated stats of COVID positive diagnoses for our foster parents, our youth in care, and our employees. So if there are staff who do not wish to hear those statistics, now is the opportunity to shut the video off. And like we said, we'll get back on our regular schedule in about a week from Sunday.
That's right. So the stats this week, along with 600,000 people that are out of power, we have our regular up-to-date COVID stats. They include 73 foster parents. 47 of those are core and kin. 26 are therapeutic foster care. 21 youth or young people that are positive. I think I mentioned last week that even though the majority are from congregate settings, that we did have a couple of kids who were diagnosed positive because the foster parent was positive.
Yep.
And really making sure that our medical team follows them pretty closely in their recovery and any of the weeks after to make sure that they stay healthy. And then our staff number holds steady at 36 staff members, with 35 of them returning to school to work. So our numbers are not skyrocketing, and I think it's because we have made some tremendous sacrifices over the last 4 months to really keep the footprint of COVID down as much as we can. We know that people within our staff have experienced tremendous losses. They've really tried to navigate communities that have been devastated by this virus and its spread. But within DCF, we have had an opportunity along the way to really keep the transmission rate low and try to remain vigilant. So again, hand washing, social distancing, mask wearing, coughing into your sleeve, and by all means, if there are any type of symptoms, even if you're not sure if they're related to something else like allergies or seasonality of what we're about to go into in the fall, have your doctor or primary care take a look at you to make sure that you can either get tested or assessed by a medical or healthcare provider.
Absolutely. So we all hope and pray Connecticut recovers from this quickly. Commissioner, we hope you get power very soon. And we'll see you again on the video very shortly.
Thanks, Ken. You
All
too.
right.
Everybody be safe out there.